our partners at the health department and let them know. We've been tracking this for more than 5 years. Our public information office has sent out various informations, I know, to your media sources. For 5 years, we've been seeing an elevation in this usage. While it is concentrated in our most vulnerable area, I have a map here, and we'll have some maps available for you. It's just basically, it is all over the city of Austin. While concentrated in the downtown area, the homeless, there are people trying this all over the city of Austin. And this is causing problems. And it's not always identified as K2 up front. And sometimes we'll have to get that after the fact at the hospitals, and that's through our health department. Because again, it comes in as somebody having a seizure, somebody just being unconscious, somebody with an altered mentation. So again, these are cases that sometimes we find out later it's from K2. So it's very important that we put a stop to this, and it is making an impact on our resources. And I appreciate the help of city management. We'll be doing everything we can to take care of the people that have the effects of this. And next is Stephanie Hayden.
Good afternoon. I am Stephanie Hayden, the Interim Director for the Austin Public Health Department. The Austin Public Health Department sees this as a public health threat to our community. We have taken a strategic approach in order to address this concern, to ensure that communication, education, and interventions are happening in our community for our homeless and other citizens in the community. We know we cannot do this work alone, and so we continue to partner with the Austin Police Department as well as EMS and local homeless service providers, as well as Integral Care in our community. We ensure that our homeless service providers have developed a strategy in order to provide information to homeless persons that are accessing their services. We have provided an effort where Dr. Wong worked to publish an article in the Travis County Medical Society Journal to educate area physicians about K2. Through our epidemiology and public health preparedness division, we continue to look at the surveillance data to ensure that we are able to track and provide information that will inform this public health threat. At the agency level, agencies are, at the shelters, are providing targeted interventions to clients. They are working with them as they enter the facility to provide information via flyer, as well as if they need connection to services that provide interventions for substance abuse services. In addition to that, at the monthly dorm meetings, they are reminded about the dangers of K2. The evening meetings, they are provided the information. And at the individual level, during the case management care plan development, they are provided information that tells them about the dangers of K2. The homeless shelters are working very closely with APD. Just recently, yesterday, a training was provided to their staff about safety and other efforts that will assist them in doing their jobs, serving the homeless population. As far as the outreach is concerned in the community, we have partners that are out in the community that are providing information, as well as licensed chemical dependency counselors that are providing that information, as well as peer-to-peer support counselors. We will continue to be vigilant and be a partner as we take this threat very seriously. Thank you for your time.
Good afternoon. My name is Ellen Richards, and I'm the Tree Strategy Officer for Integral Care. And it's an honor for me to stand here with my colleagues from the city and talk about this important issue. Integral Care works to improve the lives of individuals living with mental illness, substance use disorder, and intellectual and developmental disabilities who live in Travis County and the city of Austin. Many of the individuals that we serve and that we seek to serve and engage in services are living homeless in our community. Integral Care has professionals working on the streets every day to connect with individuals and engage them in services and get them on a path to safe and stable housing and recovery from mental illness and substance use disorder. We go anywhere someone needs help, under bridges, into camps, anywhere. We have our own teams, and we partner with other organizations, including the Austin Police Department and EMS, through the Homelessness Outreach Street Team, or HOST. Through our outreach teams and our clinics, our staff are educating every person about the dangers of poisons like K2. It's not a drug, it's a poison. In our clinics, we screen every person for substance use disorder and substance use, and when there is any indication that a person is ready to get help, we do a warm handoff to services. We've been in this community serving for 50 years, and we've learned two things. First, we cannot treat someone for substance use disorder until they are ready. We work to meet the individual where they are, and then to provide the right level of care at the right time. Second, we also have learned that recovery and stability are not possible if the only place a person has to live is on the streets or in the woods. Integral Care believes that housing is a foundation for recovery from mental illness and substance use disorder, and we will continue to work with our public and nonprofit partners to expand and improve services that help people get back on their feet so that they can work towards recovery and reaching their full potential, and this will strengthen our entire community. Thank you.
I'll take just a couple questions.
This confirmed
Any
death.
questions?
This confirmed death. Is this the first ever confirmed death from K2 in Austin?
Yes, it happened, I believe, in January of 2015, I think, or 2016. I'll have to look that up. But there is one confirmed death. There's another one that's suspected, but we don't have the information for that as of yet.
And I know that there are other states that have more comprehensive data on a state level in terms of deaths, and something that it doesn't seem that we have in Texas. How would that help you all get a more clear picture of how big this problem is?
Well, I think we actually do have a pretty good comprehensive look at it. When you talked with Jasper, he showed this is where we're having it. But when you look at where it's actually concentrated, it's downtown. It's near the arch. And you have to focus on where the largest part of the problem is. And I think we're doing that. And I think you have to focus on ensuring the worst of the drug dealers that are bringing the poison down there are the ones that we're prosecuting. And I think we do have a pretty good handle on that. I think we have a very good relationship with the DA's office. And going forward, we're going to make sure that these people are held accountable to the fullest extent of the law.
And what is the Arch's role within this conversation, since a majority of the cases, it seems like, happen right in that area?
The Arch works hand in hand with us. They work hand in hand with the EMS. What their role would be is to educate them and protect them, just like we are trying to do. The area surrounded by the Arch, you have other individuals that come and prey on the homeless. And we have concentrated on that for years, and we're going to continue to do that. And I think in numerous areas such as this, we're being successful. But when you have K2 that comes along and you cannot arrest the subject, and you literally have to release them, and then they'll walk right back and buy some more, that's our concern. Our concern is when we have 7 EMS trucks out there, 10 cop cars, and we're arresting people, and literally someone 5 feet away is making another deal. We're putting as many resources in as we can, and that includes organized crime, street narcotics, Metro TAC teams, downtown officers. The forensic lab has done an amazing job, but we're doing all we can, and we're going to keep trying to find new ways to do a better job. We think that there's always improvements that can be made, but I think with the support of the city, which we have, I think we're going to continue to address it.
How is this affecting our hospitals and other people who may fall ill? Are other people in danger because of all the attention being focused on this, all the resources?
So from a response standpoint, I mean, we're still responding to all the 911 calls that come in. We do move resources throughout the city and county to make sure we have enough resources to answer that call volume. It does put a burden on the hospitals. We try to spread them out a little bit where they can go, but there are limited beds, and they do have to be in a hospital for some period of time until they're released by the hospital. So there is an impact to the hospitals. I'd like to follow up on the question you asked me about the statewide. While we've been tracking it for some time, and we've actually probably were one of the leaders, and we went to the state and have been trying to get them to start tracking it statewide, because some of the numbers they were showing that it was very low just statewide, when we would show, well, we had 300 last month and they only had 14 for the whole state. So maybe not all the communities are seeing it like we see it. There's also how it's reported. Again, we see a lot of seizures, unconscious patients, different types of reactions to it. And so they may not pick up on it that it was K2. A lot of our folks are telling us they did it, so that helps us to recognize it immediately, not wait for testing. So I think in the last 6 months, the state has started to pick that up to see that it is a statewide problem. But you're correct, there are areas of the United States and New Hampshire and other areas that have made it a statewide public health emergency of this dangerous narcotic.
Are we tracking the long-term health effects that these folks are experiencing? Are there any long-term effects, or is it a short-term issue?
So my name is Janet Pichette. I'm the Chief Epidemiologist with Austin Public Health. There are several things that we are doing right now. On a daily basis, we routinely track emergency department encounters that come in, and we'll be focusing in on this. We do also have within the health department the Office of Vital Records, and so we can begin to track deaths. It depends again how the case comes in or how the death is reported by the attending physician. So sometimes there'll be medical amendments made to a death certificate, but we will, I think some of the public health angle from the epidemiologic perspective is to actually look at the details of the information, to take a deeper dive and see what the problem really shows us, whether there are specific exposures or risky behaviors that are included, looking at length of stay, seeing if we have the same people that are repeat offenders or are being impacted by this, because then if you do have that, we want to make sure we have the linkages to care. But as far as long-term consequences, I think there's very little known about that specifically.
We have time for 2 more questions.
Why have you chosen to treat the users as victims? And I guess the follow-up to that is, if someone uses this drug, gets ill, gets medical treatment, is fine, what's the incentive to not go back and purchase this drug again?
Well, I'll take the first one. The reason we're looking at dealers as opposed to users is we have a finite amount of resources. And what we need to focus those on are the dealers that are actually preying on people. That's not to say if there is an easy way to, if it was crack cocaine and we've done reversals down there, we try and get them into treatment. The ones that are being sold to, we try and make sure that they can get deferred sentences, but we really focus on the dealers. And I think that's always been our practice, is because we believe the dealers are the ones that are preying on the homeless. They are preying on the individuals that they're selling the drugs to. And I'm sorry, what was your second question?
That pretty much answered it. It was just asking the question another way.
One more, you guys.
Is
Anybody?
there a way for the community to get involved? Can they help with the outreach efforts?
There is a way for the community to get involved. My recommendation would be is to contact the one of the downtown shelters, either Front Steps or Salvation Army. There's several, Trinity, but any of the nonprofits that are providing services in the downtown area would welcome the community to assist them, and they will do a series of training and ensure that their volunteers have the necessary training that they need. So that would be the best way to get involved.
Thank you, guys.
Thank you.